I'm Dr. Renjith Senior Most Consultant of Mediterranean Hospitals, Kollam District. So, here to have a talk about seizures. So, in normal human beings, the seizures is a normal Malayalam, they're called as an apasmarakam. Okay, so seizures and epilepsies both are interchangeable terminologies in basically according to the layman's. So basically these are neurological dysfunctions which affects on the brain. Okay, so in medical terminology we can differentiate the seizures and epilepsies as, okay, seizures are the single most electrical outbursts occurring inside the human electrical activity inside the brain. But in case of this epilepsy is an enduring electrical outburst, and both of them are having sudden electrical disturbance which changes the behavior, then movements and feelings and consciousness of the one of the human beings. So once if it is affecting at the single episode, it is known as a seizures. If the patient is having the similar episodes more than two in a frequent interval of time, then it can be called as an epilepsy. So usually epilepsies will be associated with syndromes, with neurodegenerative disorders. So a person can have epilepsy, may not have a seizure. So what exactly seizures are? As you know that the human brain is the main central part of the human body which is controlling all over the body and which is having a lot of millions and millions of neurons. These millions and millions of neurons are firing electrical chemical synapses which is responsible for the electrical impulse connections. So once if there is any pathological changes which can affect the electrical signal impulses, especially if there's conductivity is in higher, so it can misfire, that can lead to a seizure. So the seizure is a sudden and brief disruptions. It may either arise from the single lobe, single hemisphere, or it may arise from the bilateral hemispheres. Then what type of seizures happens depends upon which part of the brain is affected. So the seizures can be classified as a generalized seizures and partial seizures. So in partial seizures, mainly they are called focal seizures. Okay. So generalized seizures means once the seizures activity is occurring in the entire part of the brain, the patient will be losing the consciousness. But in focal seizures, once if it is affecting any part of the brain, so it will be manifested as which part of the brain is involved, as depends upon the homunculus of the brains. Then regarding diagnosis, we can go for a magnetic resonance imaging. Then especially we are having magnetic tractographies and the functional MRI scans and the SPECT CTs and other things are there. And among them, EEG is having a better doing as a good pivotal role. So regarding the treatments of this epilepsy, we are having a lot of anti-epileptic drugs. So most of them will be blocking the sodium channels. Some of them will be blocking calcium channels. Some of them are having both of these functions. So among them, the one important elixir, according to terminology, an elixir in this anti-epileptic era, that is levetiracetam. So we are having the Epilev here. It is mainly good for generalized seizures and also for the partial seizures, mainly for myoclonic and also for the tonic-clonic seizures. So it mainly acting on the SV2A channels which reduces the impulses, and finally it will be reducing this electrical outburst and we can reduce the electrical synapses. So thus we can reduce the seizures. Then why we are using levetiracetam? So because we are having phenobarbital, then carbamazepine, then valproic acid and lamotrigine, and other things are there, but everything is having the same efficacy as same type as levetiracetam. So in case of phenobarbital, these drugs are having multiple drug interactions with the enzymes like a CYP2 A3/4. Okay. Then second one's carbamazepine is having a lot of side effects. Then if you are going for valproic acid, it is having a lot of hepatidoxicity and pancreatitis. There are a lot of chance for the complications. But among this levetiracetam, especially for Epilev, we are having the good oral tolerability and good efficacy, and there is minimal side effects which can be given in a liver decompromised patients itself. So nowadays we are prescribing levetiracetam, especially Epilev, Lupin product. Thank you.